Omicron variant includes different lineages. B11529 is the primary, and then there's BA1, BA2, and BA3. Of note, the asterisk by BA2 represents what is being now termed as the stealth Omicron variant, which has some characteristics that slightly differ. It is not a separate variant of concern. Next slide. So this graph shows latest data provided on January 21st, 2022. Again, this is showing a reduction. This is courtesy the UK Health Security Agency, and shows over the last 7 days there's a decrease of minus 27% in terms of the number of cases. So we're seeing some dipping of the number of cases occurring, and you see that upward surge followed by a decrease. If you remember, the South African variant, it was picked up first in South Africa in November, and then about 6 weeks later you saw that decrease in South Africa as well. So it seems to be taking about a month to 6 weeks to go into a peak and then coming back down, which is generally a good sign, and we'll see how that at least that takes over into Trinidad, and see what happens over the coming weeks. For many countries, the next few weeks remain critical for health system workers and health systems, because we have, in Trinidad and Tobago especially, our system is still full, so we want to make sure that balance stays the same, and that we can cope with the number of cases that occur. Next slide. So just an update from the UE agency. They had 56 Omicron cases detected to date, and that is for the last week. A little over 2 weeks ago, Omicron accounted for 25% of the sequences so far, and last week of samples sent for sequencing, 56% were Omicron, 46 were Delta, and a few were residual Gamma cases. Next slide. So basically we're at a stage where you find that the Omicron variant is now seemingly the dominant variant, and Dr. Hines would have indicated last time he was here that it's fairly well established in the community, so we can safely say we are at a community spread stage. So it is within our society, and it further emphasizes the need for us to vaccinate and to get our boosters as soon as we can. Last slide. Again, the last slide just emphasizes the basic principles, which is wearing a mask, and you're wearing your mask to cover your nose, mouth, and chin at all points in time, remembering it is part of the law under the public health regulation. Watching your distance, maintaining 6 feet apart as far as possible, and washing your hands as often as possible. As you saw with new variants, there may be increased risk of spread via fomites, which is inanimate objects, and it requires you to wash your hands more often, certainly not touching your face and your mouth. So, Mr. Alexander, that's my update for this morning.
Thank you very much, CMO. We will now listen to a presentation by Dr. Extavor on COVID-19 vaccine, its approval and support. Dr. Extavor.
Thank you, Mr. Alexander. Good morning, Minister Dayal Singh, Dr. Parasram, members of the media, and the listening and viewing public. Thank you for inviting CARFA here to share this. May I have the first slide, please? So my role here today is to give some clarity to differences between the WHO working groups, one being the Strategic Advisory Group of Experts for Immunization, the team that works on the emergency use listing process, or the pre-qualification team, and how CARFA CRS, which is the Caribbean Regulatory System, supports the work of our ministries and our regulatory bodies. Next slide, please. So this slide, you may be a little challenged to read, but on one side I have some of the key functions of the WHO Strategic Advisory Group of Experts. And this is the group of experts that issue the interim recommendations related to individual vaccines. And they would look at the overall policies and procedures in terms of reviewing literature, current studies on the effectiveness and efficacy, as well as the safety of the different vaccines, to determine how it should be used. And they would recommend populations in which it should be used. They would indicate the dosing as well, and other interventions that may affect its use, or populations that may benefit from its use or may need to avoid its use at a particular level or be prioritized differently. So this group has its work cut out for it, yes, of course, But it's different to the group that reviews the dossiers, that is the collection of information submitted by a manufacturer to a regulator or to the WHO, in which they would apply for emergency use listing or what they call pre-qualification. And this is an extension of a program that has been going on before, because WHO has this program to pre-qualify medicines, vaccines, and test kits. So the manufacturer or the sponsor submits the information on the clinical safety, efficacy, the trials that were done, how the product is manufactured from start to finish, how it was tested in animals and humans, as well as information on its packaging, its formulation, and its stability. So although the two groups may look at clinical data, the WHO EUL, or the pre-qualification team, looks at much more related to how it should be used, how it should be drawn out, how it should be stored, so that health workers will receive the product information leaflet that guides them to use it appropriately. Now, once the vaccine or medicine is pre-qualified or listed under EUL, that's not the end of the pre-qualification team's work. They also would be updating their information in the product insert or how it should be used, as long as information is being shared and there are ongoing studies. For example, where an ongoing study on stability indicates the vaccine could be used or stored for much longer, then you tend to have reviews by this team, and they would say, yes, it can now have a longer shelf life, or they may adjust how it would be stored. So in this regard, the EUL process is a little longer, and any changes that happens to the vaccines that's shared with WHO, they would also have a bit more time to review that information, ensure that the manufacturer has provided the evidence to support the new group it's going to be used in, or the new way it should be used or stored, and then they would update the emergency use listing profile of that vaccine or medicine. So these are two independent bodies, but they have very important roles for our regulators. And keep in mind, the pre-qualification team's updates may come a little later than the SAGE's interim recommendations. So could we go to the next slide, please? The Caribbean regulatory system under CARFA is a regional mechanism that helps our member states understand the dynamics, the product information, and what happens in terms of the reviews of vaccines granted EUL. We've been able to collaborate with the WHO to access the EUL dossiers, so we do look at any updated information that may be added there. That information is not just for the EUL vaccines. We also do this for other medicines that may be considered for marketing in CARICOM. Member states or countries that have legislated bodies or committees that review individual medicines to come into the market, like Trinidad and Tobago, may use our recommendations, because we would issue an assessment report, and those committees can utilize our summaries to make their decisions or to check information they are not clear on. Similarly, countries that do not have a full registration process but may have an import approval process can still use our summaries to check to see what are the quality indicators, safety, efficacy, formulation, storage, and all the key information they need for health workers to use the products effectively. In addition, we do have technical support in terms of webinars for our regulators. We also support quality and safety monitoring, or what we call pharmacovigilance. So in all, we continue to work with our member states and collaborate with the WHO to provide updates that would help our committees make safe decisions for the public. Next slide, please. So these are just brief takeaways, just to remind you that there are differences. There are two main groups that we look to from WHO as it relates to how the vaccines are used. The SAGE group will issue its recommendations for use in clinical settings, and the EUL or pre-qualification group looks at the dossiers in more detail, and CARFA CRS provides a branch or link or bridge between understanding some of the more details for our member states to make expedited decisions, but those that are sound and supported by evidence. I thank you.
And thank you very much, Dr. Exavor, for such an insightful presentation. I now hand you over to the Honorable Terence Dialsing, Minister of Health, who will provide us with today's vaccination figures and address the current issues relating to the national COVID-19 vaccination campaign.
Thank you, and good morning, Al. Good morning to the Chief Medical Officer, Dr. Roshan Parasram. Good morning to Dr. Rian Extavor, my old lecturer from my days in UE. Nice to see you again. Let me bring you up to date with the newest vaccination numbers. Total number of persons vaccinated, fully vaccinated, stand at 686,586, which is 49% of the population. I think we in health are eagerly awaiting when we can say it's 50%, or roughly 700,000 persons. Currently, our daily uptake of vaccines for both first doses and the J&J is roughly about 500 a day. We could do better. Let's try and get that up as fast as humanly possible. Total number of boosters administered to date, 107,211. So that is what is happening on the vaccination front. Other matters of public interest, which I can announce. So let's pick off where Dr. Exavor left off, with the Pfizer vaccines for the 5 to 11. We had come to you last week, Saturday, after WHO gave their interim guidelines on the vaccine for Pfizer vaccine for the 5 to 11 age group. At Saturday's press conference, I would have indicated that we had to have our technical meetings with PAHO, CARFA, and others to dissect what that communique said. The information that we have so far, that we have looked at between Saturday and this morning, seems to indicate that at this time, the approval is granted for the special pediatric formula, which is slightly different from the adult formula we currently have. At this time, it seems that the Pfizer vaccine that is approved will be the pediatric formula, which, as we indicated, is a different dosage, is a lower dosage. The buffer is different, and the packaging is different. We at the Ministry of Health have been in talks, bilateral talks with Pfizer since early December. I think it's December 2nd, to be exact, with Pfizer, as I indicated earlier, for both Paxlovid and this pediatric formula. We have signed a non-disclosure agreement, but just to let the country know, we are in the marketplace actively pursuing the special pediatric formula, which at this time seems to be what we will have to use. So we are in the marketplace for that. We are also pursuing initiatives, as we have done in the past, via CARFA for a collective procurement of the same vaccine for the Caribbean region. So we are exploring all alternatives to procure these vaccines for the 5 to 11. As soon as we have word as to when and how many doses and shipment particulars, as usual, we will come to you. So that is the first announcement. Second announcement has to do with the COVID outcome study with the team headed by Professor Terence Simangal. They have written asking for an extension in time. I have sent it upstream to the Honorable Prime Minister, and the Honorable Prime Minister has agreed that the study will take a 1-month period. So the first time frame was a week. They have asked for and received a 3-week extension. So the Honorable Prime Minister has signed off on that. The third announcement I'd like to make, again, and I am authorized to say this by the Honorable Prime Minister. The Honorable Prime Minister would have met with the Chief Secretary of the Tobago House of Assembly, Augustus Foley, and a decision has been taken, and I've been authorized by the Honorable Prime Minister to say this, that from Monday, 31st January, that is next Monday, beaches in Trinidad and Tobago will be open from 5 a.m. to 6 p.m. This will also extend to reef tours, swamp tours, and other like activities, but with a 50% capacity. And we urge no partying, no alcohol, and so on. And we urge caution after the beaches close at 6 p.m. to please no after beach line partying, especially with your masks off and so on. The regulations will be amended to give effect to these changes that kick in from Monday, the 31st of January. So let me just repeat that part. The Honorable Prime Minister has authorized me to say that after talks with the Chief Secretary of the THA, beaches across Trinidad and Tobago open 5 a.m. to 6 p.m. That will include reef tours, swamp tours at 50% capacity. So those are the major developments that have occurred, and I thank everyone for their patience. I thank everyone who is going out to be vaccinated, and urge that more and more people use the opportunity to get vaccinated. Thank you very much, Al.
Thank you very much, Minister. And as we move into the question and answer segment, we want to invite members of the media to pose questions to the panel. Media representatives, please state your name and the name of your media house before posing your questions. You'll take 2 questions per media house during the first round of questions, after which we will field follow-up questions once time permits. Kindly pose 1 question during all other rounds of questions. We begin today with 103.1 FM. Good morning.
Hello, good morning. Rai Komas from 103.1 FM. The first question, Minister Dialsing, a couple weeks ago, we at the station here, we raised with you an incident in which a citizen said that there was a lab mix-up with their COVID result, and you asked for the person's number to look into that case. To date, they haven't received a call. Why is this? Since it again raises concerns as to whether or not the ministry or the CMO's office are checking on private labs that have been cleared to do PCR testing. The other question to anyone on the panel, can you say if there have been any cases of persons with a booster shot being hospitalized with COVID-19? Thank you.
Okay, so I'll take the first question. So I'm just checking with Al because we had indicated to send the information to the Corpcom, and he has indicated he did not receive the information. So if you have it, sir, please send it to Al or Candice at the Corpcom, and we are eager to understand what happened and bring some clarity to the issue. I will turn you over to the CMO for the other part of the question.
Yeah, so in terms of your booster, so generally what we check is in hospitalization of fully vaccinated people. As you know, the booster would have recently started, so we have about 100,000 people now with boosters. We'll go into the records and check to see if anyone with boosters have been hospitalized over the period of time quoted, and we can get that information back to you.
Thank you very much. And again, you can send your information to corporate communications at health.gov.tt. We now move to azpnews.com. We're ready for your questions.
Good morning, Private Harry, azpnews.com. My both questions are from the CMO. AZP News, we have had two cases of people who have gone to Canada. They have tested positive for COVID-19, and after some weeks they continue to test positive via a PCR test, and they're unable to return home because, of course, the TT pass, you need a negative PCR test. They are being told that there may be a flaw in the PCR testing where, although their viral load is very low and they don't pose a threat to spreading the disease to anyone, they still test positive. I don't know if the ministry is aware of these issues and if anything can be done with this cause. And my second question has to do with with the chemistry, food, and drug lab again. There are some concerns by people who are seeking to have their drugs, their supplements, their medical devices approved, and they say it's taking quite some time, and they're being asked for documents that only the manufacturer that even the manufacturers don't have, and they said a lot of discrimination and hindrances are being placed in their part. Whereas, for example, the antigen test kits have been approved in a shorter space of time, and they have been waiting for years and spending, I think, $700 every time they have to make this application for approval. I don't know if you want to shed some light on that. Thank you very much.
Okay, so with regards to the nationals in other countries who are looking for, basically what you're saying is that they continue to test positive and they want to fly with a positive result. The country's national protocol for now, as I said, is under review by the CMOHs and by the Port Health Activities, recommends that you have a negative PCR 72 hours prior to entry into the country. That is part of the entry protocol for now, and constant review is ongoing. If anything changes, of course, we'll let the population know. That last part that you said about there's a flaw with the PCR testing. PCR testing is the gold standard for diagnosis of COVID-19. It is very sensitive and specific, and if you have viral material in your nasopharynx, when they take the swab, they will pick it up. I don't think there's a flaw at all. I think that's why it is the gold standard for testing. Using other tests will probably be prone to false negative and missing the virus that is there. It can't be said definitively whether persons who have virus in their nasopharynx by swabbing are infective or not, and we have maintained the stance that the negative PCR for now is required. As it relates to your second question, I think it's more than one question in there, but generally speaking, the process for Food and Drug for registration of drugs is something that is within the Act. The Medical Devices Act is separate from the Food and Drug, is a separate part of the Food and Drug Act that deals with medical devices as opposed to drug registration. So the Director of Food and Drug is responsible for the entire process for both pathways. I can raise the concern that you have raised and look into the process, but I haven't seen any specific instances coming to me, especially with the call of discrimination and that sort of thing. We have been trying our best to make sure that the registration process is as smooth as possible. We have met with the Chambers of Commerce together with Food and Drug, individual suppliers as well, to try to clear any backlogs that are perceived or real. And we will continue to work as best as we can to ensure that there's equity across the system.
Thank you very much, CMO. And we move to TV6. We are ready for your questions.
Hi, good morning to the panel. Alicia Boucher from TV6 here. My first question is for the Minister. Minister, we saw what happened at the beginning of the pandemic when these vaccines were approved and how hard it was to get these vaccines from the vaccine manufacturers themselves. So I wanted to find out, now that the WHO has approved this special pediatric formula, do you anticipate that there will be a rush for that particular vaccine from first world countries? And does the non-disclosure agreement that we've signed put us in a much better place than we were previously, as we had tried to acquire vaccines? Would we be using the American medical supply platform, etc.? So that's my first question. Second question is from a member of the public, and they want to find out what are the terms and conditions under which Cuban medical staff is coming into Trinidad if they are vaccinated with Cuba's vaccine? Are they counted as being vaccinated?
Thank you. So the issue of vaccine procurement, yes, we have signed a non-disclosure agreement with Pfizer, and we started these negotiations prior to WHO making the announcement. So we are confident that we are in a pretty good place, because I can't disclose the nature of the conversations, but just to assure you that we are exerting a lot of force and a lot of pressure across all avenues to ensure that we get vaccination stocks. On the issue of the Cubans, I think we got about 25 last year. Before, I think that was before we had the vaccination protocols. I will have to check, but as we did, they were all quarantined before they went into the system. So that is as much information I have at short notice on that issue.
Thank you very much, Minister. We now go to Guardian Media Limited. We are ready for your questions. Good morning.
Hi, morning everyone. Rashad Khan, Guardian Media Limited here. My first question is to the Minister of Health. Minister, could you say why it is, or did Professor Simangal and the committee say why it is they wanted some more time with that report? And my second question is to the Chief Medical Officer. CMO, there has been some concern from parents about the return to classes from February for students. And I'm just wondering, what are your thoughts on this, and did you approve something like that?
Thank you. So, Professor Simangal requested an extension of 3 weeks. We at the Ministry of Health are not micromanaging the issue. It has to be a fair, transparent, independent issue. I did not ask for details as to why, but I would imagine he wants to do a very thorough investigation, and he is acting independently of the Ministry of Health. What I did was indicate to the Honorable Prime Minister, because this is the Honorable Prime Minister's initiative, and indicated that they needed an additional 3 weeks, and the Honorable Prime Minister agreed to it. Turn you over to the CMO.
The second question, I think that question will be better answered in the sense of the Ministry of Education. So they would have put out their notice yesterday or day before, indicating what pertains, and that question will be better posed to the line ministry.
Thank you very much. We now go to the Newsday. We'll take the questions from the Newsday.
Hi, good morning. This is Paula Linder from the Newsday. My two questions are for Minister Dialsing. The first being, have you received an update from Minister Hasselbachus from the Digital Transformation Ministry as to the status of the vaccine verification initiative? And the second was, which stakeholders has the ministry consulted on the vaccination plan for children under 11 for when we get those vaccines? Thank you.
Thank you. So Minister Bacchus and Ministers Bacchus and Young made an announcement a couple of weeks ago, which was carried in the newspaper, indicating that there were some global security issues regarding databases and so on, and that was the major element of the kickback. I will be speaking to Minister Bacchus on this tomorrow, and hopefully by Saturday we can give you an update, but as soon as they are ready, they will roll it out. On the consultation with stakeholders, so just to remind, on Saturday I indicated that we will have, first of all, technical consultations with PAHO and CARFA. That has been done, and that is why I could say that the position as it stands now is that the formula spoken about in the interim guidelines seems to be the special pediatric formula. So we have had those meetings. That has been done. We are also liaising with the Pediatric Society, and those talks will be ongoing. Now that we have this indication out of our technical meetings, we will convene a meeting via the Office of the Chief Medical Officer with other stakeholders like the National Parent Teachers Association and so on. So that is how much consultation has been had between Saturday and today, and this is where we are going forward. Thank you.
Thank you, Minister. And media, you are welcome to pose questions to Dr. Exavo on her presentation. And we move to AZP News for a follow-up question.
Thank you all, and I do have a question for Dr. Exavo. Dr. Exavo, sometimes people who don't want to take the vaccines, one of the arguments is that this is still an experimental vaccine, that it took such a short time to develop when compared to the vaccines we got at children for rubella, for mumps, etc. What is your argument for that? Thank you.
Thank you for your question. What we can assure you of is that although there were processes that were done in parallel, there weren't any shortcuts taken in terms of the quality of the information and the information needed to be provided because the burden of proof remains with the manufacturers. The WHO would not and does not approve anything for pre-qualification or for emergency use unless there's sufficient evidence that trials were conducted appropriately at the appropriate sites, that the vaccines or products are manufactured in sites with proven quality indicators, what we call good manufacturing practices, that the process is clear. So there's a lot of information that is submitted and was moved through. The reason a lot of things moved as well is that the WHO didn't only rely on its internal teams, it worked with groups of regulators from around the world. So on the EUL, you will see National Regulatory Authority of Record, and that's because they worked in parallel. So those authorities had their teams, as well as the WHO had their teams, and a lot of work was done in parallel. Also, some of the vaccine technologies we are speaking of have been used in other vaccines. So the information related to proving their efficacy, safety, their formulation had already been established. So it's a matter of saying when we add this particular drug substance, whichever code they use, we want to say when we put it in this encapsulation, we can show it works. Also in terms of clinical trial conduct, a lot of the animal studies and clinical trials were also done. They weren't rushed because if you don't take enough time to show the result to prove that it works or is safe, it would not pass that level of authorization either at the national level or at the international level. So that's the general overview I can give of it. I do understand persons have concerns. The experimental parts had been started and generated sufficient information for us to feel it was comfortable. For instance, in medicines, you may have groups of 5,000 persons. When we come to vaccines, those trials have to be done in 20,000, 50,000, sometimes tens of thousands. So it's much wider and larger groups for that evidence to be produced, and it was produced according to the standards set. I hope that helps.
Thank you very much, Dr. Extavor. And we move to TV6. You ready for your question?
Hi, yes, Alicia Boucher again. Yes, I'm here. Okay, so I don't know who will want to take this question, but we're seeing now the emergence of the BA2 variant, which they say is some cousin to Omicron. And I'm seeing a report that says, where cases had initially fallen after
Ms.
a huge
Boucher,
surge
we're having some challenges hearing. Could you speak a little louder, please? Thank you so much.
Okay, sure. Are you hearing me better now?
Much better, yes.
Okay, great. So we're now seeing the emergence of the BA2 variant, which they say is a cousin to Omicron. And I'm seeing a report that stated in South Africa where cases had initially fallen dramatically after a huge surge. The BA2 variant is now more prevalent than the BA1 variant. CMO minister, does it mean that we're in this pandemic for a lot longer than we perhaps anticipated, because we already know how transmissible Omicron is, and to have the BA2 variant be more prevalent there now, what does this mean for us?
So you have asked $1 million question. Are we in this for a long time? The answer is no one knows. No one can put an end date to this COVID issue. I think that is a question being asked around the world, and scientists so far can't put an end date to it. What we do know so far is that once you are vaccinated, you stand a much better chance of getting through COVID without being seriously ill or dying. But I'll turn you over now to the CMO for a more technical response.
No, I don't think we could give a more technical response. Generally speaking, I mean, having a more, what it means that we have a more transmissible variant is that, of course, a lot more people will be infected in a shorter period of time. So by way of timeline, generally infections run through populations much faster if you have a much more transmissible disease. If you look at Omicron, for example, you saw in 6 weeks you're going through big populations, and you also see that some literature has suggested 90% of the cases being little or no symptoms, which means that it's very hard to detect it. The meaning of stealth on the front of the new variant or the new lineage that is described gives the impression of, you know, not being able to be easily detected. And again, it speaks to the asymptomatic nature and the speed of spread. So, as Minister said, no one can put an end to the pandemic as yet, but the more of the world, the greater proportion of the world being vaccinated is what will at least allow us to be in a situation where the majority of persons may continue to be infected, but their symptoms will be much milder because of the protection offered from vaccination, and therefore the hospitalization and the deaths will definitely fall, and that's the place that we all want to be.
And let me just make a point. I was answering a question in the Senate yesterday, and I made the point using the data that Dr. Richards has given me. Even though our caseload is relatively high, what we are noticing is that the number of hospitalizations is going down. Between December 27th and January 25th, the number of persons needing hospital care has decreased by 122. Now, that is significant when you consider that the hospital capacity is 706. That is outside of step downs and so on. And as Drs. Hines and Dr. Parasram will tell you, one of the indicators or one of the reasons for this is vaccinations. We have roughly, let's just say for argument's sake, 50% of the population, roughly just under 700,000 persons vaccinated. That's a pretty decent number, but it could be better. And more people who get vaccinated, you will start to see more and more positive evidence based on our numbers in hospitals, our numbers in ICU, our numbers dying. So the message is, Alicia, and you have really raised a nice topic for discussion. No one can say when this will end. No one at this time. But what we could say is that we could hasten the end of the COVID pandemic if more and more people get vaccinated. I think that's a reasonable statement to make, CMO and Dr. Exavo. We could bring forward the end by more and more people being vaccinated. So again, the vaccines are there, they are safe, they are effective. We now have some evidence that it is leading to less hospitalizations. 50%, roughly 50% are vaccinated. And if we could get more and more people coming in to be vaccinated, then we could hasten, as far as Trinidad and Tobago is concerned, you know, the end of this in Trinidad and Tobago. But then the same thing applies around the world, right? There are some countries in the world that are only less than 5% vaccinated, less than 2% vaccinated for different reasons. So we need to have not only a local push to get vaccinated, but a regional and a global push to get vaccinated. Thank you for raising that very important issue, Alicia.
Thank you very much, Minister. I see Guardian Media Limited's hand is up. We'll take your question now.
Thank you again. One part of my question was not answered previously. Let me just reframe it in a different way. What was the advice given by the Ministry of Health to the Ministry of Education on the reopening and that return to physical classes come February?
So the Ministry of Health fully supported the position of the Minister of Education and by extension the Cabinet that in a return to normalcy, when you weigh the risk versus reward, children should have access to schooling. And this is a global position. The Honorable Prime Minister last year, and we support him, would have read and referred to a report from UNICEF about the harm that is being done by keeping children away from physical classes. So we at the Ministry of Health fully support and fully endorse the position that children who are gradually being reintroduced into physical classrooms is a very wise move. Whatever risks there are far outweighed by the benefits to children, the benefits to their parents, the benefits to their socialization, their access to nutrition, their access to meeting friends. You have some children for 2 years now don't know who their peers are in schools. That is not a good thing. So, Richard, the Ministry of Health is in full support of the Ministry of Education in providing the advice that a return to school, to physical classes, whatever risks there are, because in this pandemic, every time you open up something, there will be risks. The risks are far outweighed by the social, educational, and health benefits that will accrue to having children back in physical classes.
We'll take a follow-up question from TV6. Okay,
I'm not
Newsday,
getting
we
the
go to Newsday.
Oh, sorry. Okay, I'm on.
Okay.
Okay, so yes, maybe the CMO can answer this question. CMO, I know some countries, they are keeping a track in terms of their breakthrough infections, and I was wondering if we are doing the same, and if we have statistics to say so far how many breakthrough infections we've had of COVID-19 among the vaccinated. Also, I just want to follow up from something Minister just said. Is it possible that because the Omicron variant is now the dominant strain in TNT, that's one of the reasons why also, apart from vaccination, that hospitalizations are decreasing?
So we do expect that there will be breakthrough infections, especially as we have new variants of concern coming on stream. And we said that when Delta came into Trinidad and Tobago, and it really underscores now that Omicron is here, that will see breakthrough infections. I think the proportion will be quite different from Delta. We haven't been tracking it actively in terms of infections. What we are concerned with, the proportion of people that are hospitalized, will tend to decrease the more people in the society that are vaccinated in terms of proportion. So we are concerned with the hospital levels, and the question that was asked about people having boosters. We are beginning to track now that sort of information and compile it through the EPI unit. And of course, once we have enough data on that, we can present that bit of information as well. So what is important to note in a population is who is being hospitalized, and the persons that are dying, are these persons vaccinated or not? And that is what we have been presenting to the country. The second part of your question asks, just say the last part over for me, please. Repeat it. Ms. Boucher?
So we will
Yes,
come back.
sorry about that. Yes, so
Yeah,
the
sure.
second
Yeah, go
part
ahead.
of the question, sorry, the second part of the question, I know Minister stated, in terms of although we have more cases, we have lower hospitalization levels, and I was asking, apart from vaccination, is it possible that because Omicron is now dominant in Trinidad, that is actually one of the factors contributing to lower hospitalizations?
Well, hospital as an outcome is multifactorial in nature, right? Knowing what we know about the Omicron variant in terms of the severity of disease, certainly it can be a contributing factor. The general state of vaccination in the country is also a contributing factor. The amount of persons that have been infected over the last 2 years is a contributing factor as well, meaning those who would have gotten some level of immunity based on previous infection. So if you look at all of those things in combination, we have had a surge since the best part of October, November, December, and now into January. which would have meant that a large number of the population would have been infected in terms of percentage recently, which will give them some level of immunity, together with the Omicron variant becoming dominant, as we can tell. So it's all factors mixed in, but certainly it can be a contributing factor to what we are seeing today. But it's certainly not the only factor.
Another contributing factor, and Alicia, again, you have raised a very good topic for discussion, and CMO can probably bear me out here. When the Omicron variant first surfaced in December, I believe, the early evidence, which was later borne out, said that the more people who are boosted have a higher degree of protection against the Omicron variant. So in Trinidad and Tobago, we have just over 100,000 persons boosted. That will give those 100,000 persons a level of protection against Omicron. So again, Alicia, second excellent topic raised this morning, and it just points to the fact, if you're not vaccinated, start the process. If you're vaccinated, get boosted. Okay? Thank you very much.
Thank you very much, Minister and CMO. I just want to remind the media, though, that please, we're in our second phase of questions, so one question per media house at this juncture. We go to Newsday for your follow-up question.
Hi, good day. Paula Lindo here again from the Newsday. My question is, has there been an increase in reports of people with flu-like symptoms who have tested negative for COVID-19? Do we have a flu virus going around in addition to COVID? Thank you.
So certainly, as you know, Dr. Hines would have been presenting the amount of positivity related to those who would have had viral illnesses and then presented as positive for COVID, I think upwards of 60% in the last few weeks. We are in the midst of the influenza season as well, which normally runs from October to May thereabouts in any country in this hemisphere. And we expect to have some of the persons that are exhibiting flu-like symptoms to be influenza as well. So far, I think in my last epi, as of January 1st, we would have had 192 suspected cases compared to 855 of the previous year. So when we look at the public health measures that are in place, the masking, hand wearing, doing the distancing as well as hand washing, we see that they are having an effect on other viruses as well, certainly other respiratory viruses. Decreases in other viral-like illnesses have been noticed in the trends over the last 2 years as well. So the proportion of persons testing positive, let us say, is 50 to 60% with flu-like illnesses. The others normally form part of the common cold or any other flu-like illness. So there are lots of other viruses that still remain in circulation, including the influenza virus.
Thank you very much, CMO. Guardian Media Limited, we will take a follow-up question from you.
Thanks, Al. This question is for both the Minister and the CMO, actually. Minister, how many more or how many doses of the Pfizer vaccine do we have remaining in hand? As we know, it's about to expire in February. And CMO, where I'd like you to chime in is, I've been hearing a lot from people is that, well, boy, this thing will not expire. I don't want that. What if it expire when they give me it? And that kind of thing, those kind of concerns. So maybe you could explain a bit more about that and address those concerns?
Yeah, sure. So the expiry, as you know, is really sent from WHO in terms of the expiry. With this particular batch of Pfizer, we had 9 months shelf life from the date of manufacture, which puts us to the end of February. Once there's an expiry date on a product, generally it means that it is good until that particular date is met, and it doesn't go beyond that. So generally speaking, once it's stored within the required temperature controls, which we have all our vaccines within the requisite temperature controls, the date of manufacture is what we use as the base, and the date expiry is given based on shelf life and determinations of half-life of any compound, and that is what WHO uses to determine what the shelf life is. The ones that we have in Trinidad are due to expire at the end of February, and once the storage conditions continue to be met, they will be good until the end of February.
Thank you. So I will answer the question on the numbers, and then we go to Dr. Extavor, and I'm glad she is here. She could talk a little bit about what expiry dates mean and this thing doesn't just go from good to bad overnight. So the number of doses of Pfizer, 298,162. So that answers that question, and now we go to Dr. Extavo.
Thank you, Minister. Just a note that with setting of shelf lives, it's based on stability studies over a period of time, and the manufacturers, and usually they put this in their documentation, that they roll back and will give an expiry date that ends the month just before they found this study would have said cannot guarantee. However, what I want to highlight is that on the first of the next month, the vaccines or the medicine does not simply deteriorate all 100%. There is a period of time over which the manufacturer says, okay, we cannot guarantee it past a certain date, so out of safety, this is the date we give you. But it doesn't simply deteriorate and fall apart. We do advise persons to adhere, and the ministries are guided accordingly through the product information and its use, and we are confident that they plan according to the given dates on the shelf life.
Thank you very much. We will go to TV6 for a follow-up question.
Hi, thank you again so much. Minister, I know that the medical system is a bit strained in terms of resources, and I was wondering if we can get an update on the 40 Cuban nurses who were supposed to be coming to Trinidad. I believe you had said that 40 additional Cuban nurses were supposed to be entering the system.
No, what I said was 40 Cubans they were already here, and their contract period would have come to an end, and we simply rolled them over, right? So those were not new persons. They were persons that rolled over in addition to the others that we got over the years, okay?
Thank you very much, Minister. And our final question comes from Newsday for this morning. We're ready for your question.
Hi, good day. My last question is for the CMO. While we are very concerned about Omicron spreading in the population, should we also be wary of the fact that Delta is still around, and the fact that it is still, while not as transmissible, it has worse effects than the Omicron variant? Thank you.
Yeah, I think that's a very good point. So the average person, we can't tell which ones of the variants we're going to get infected with at any given point in time. We do have Delta as well as Omicron, more or less just over 50% each at this point in time from what we can tell in terms of the cumulative samples that have been sequenced. So we're asking continued adherence to the public health guidelines, getting your vaccine as quickly as you can and get it boosted. You're not going to know whether you have Delta or Omicron unless you are sequenced once and for all. But at the end of the day, it is something to be considered and to be cognizant of, that Delta is still here. We actually had samples that suggested that a few cases of P1 were picked up. And as you know, our P1 was the Gamma variant that was picked up over 6 months ago, more than 6 months ago. So there may still be residual traces of Delta. It's not that once you have a new variant of concern, it completely obliterates the other variants that were there before. So we have to be concerned, generally speaking, that COVID-19 still continues to be a severe disease that is causing severe illnesses and death, and we have to follow all the guidelines and get vaccinated as soon as we can.
Thank you very much, CMO. And as we close off today's media conference, we want to thank our presenters and you, the listening and viewing public, for your presence here today. We leave you with 2 testimonies of persons who decided to take the COVID-19 vaccine. So we're saying goodbye, and please stay safe.
Hi, my name is Janelle Albor. I am from Rio Claro area. I took my vaccine at the Rio Claro Health Center, and the reason why